I think we're just gonna take a second here to get away from the audience questions and just gonna ask you why you think it's important to get like a second opinion while dealing with serious medical health issues.
um, I think this is definitely a very, very important because, always if you look at not necessarily medical or any fields, having an extra set of eyes is going to be important because, there may be subtle differences in treatments, for example, or there may be some newer treatments out there, or again, guidelines. In the States, we have certain guidelines that we use to keep the standards. So, for example, if someone comes in with a certain disease process, there are certain things that we have to use to kind of help treat it. And these are things that are based on medical studies that have been tried and has worked. So, and again, each scenario is different. And, just to have an extra set of eyes to make sure, okay, yes, A is checked, B is checked, C is checked would be good. Another reason could be, there may be extra tests and stuff that can be done. Is there new clinical trials? There's always the beauty of practicing here is we're involved or we're closely associated with some of the bigger universities. So there could be potentially clinical trials that's going on where they're maybe trying different, medications and stuff. So it would be nice to see, okay, there are certain things that we can use to kind of help treat, so that would be the main reason. And like the physicians that I've worked with in India, again, personally, my family members, some who were ill, they were amazing. Those doctors are amazing. But I think, when I was in the patient side, or family member side, I always wondered, okay, what could be done better, or if if they have another resource where they can touch base with another person. For example, small villages and stuff. Let's take for example, someone comes in with a certain diagnosis, having a second opinion and access to a second opinion may give the person a little bit more relief, like, okay, yes, my doctor's great here, okay, but just in case, is there other therapies that's available, this will be a good place to start, I guess.
Mhm. Thank you. Yeah, I think this extra set of eyes
Thanks,
is
Tom.
definitely appreciated when you're looking at something so complicated and critical. Yeah.
Yeah.